It's been a few months since I've done a health update, and I know a lot of you have asked how I've been doing, knowing that I had hip replacement surgery. Well, it's been quite a roller coaster, as we expected. I had a very good surgeon. I knew he was the best. I had seen his credentials, and I was very lucky to have him. So the surgery went quite well, just as expected. They kept me overnight in the hospital, which is kind of unusual. Nowadays, they normally just send them on home and it's done as an outpatient surgery. But knowing my other health issues and my health insurance company had stipulated that I be kept in the hospital overnight. So that's what they did. And it's a good thing they did because I did, predictably, go into an adrenal crisis. I needed more cortisol than I had in my body. My body does not no longer make cortisol. And this is a long, involved story. And if you know my health history, you know what's going on here. So adrenal insufficiency is a life-threatening condition. Every cell in our body needs cortisol. And when they don't get it, they start to die. Cells die, organs die, you die. So when I went into crisis and they had been instructed, they knew to give me my medication. Unfortunately, in the hospital, it doesn't happen instantaneously. There are protocols and standards and such that they have to go through. So they had to get down to the pharmacy, get my medication, and bring it up. Well, when they brought it up, they only brought one of my steroid pills, and I needed 3. And they said, well, you'll get your next one in 6 hours. I said, it doesn't work that way. I have to have them all at once. This particular steroid, methylprednisolone, which is the generic term for Medrol, stays in the body for like 16 hours. So I need them all now, and that will last me for the day. So they had to get approval from the doctor and then go back to the pharmacy and all that. That took an hour and a half. In the meantime, I'm having an adrenal crisis, which means lots of shaking, convulsing, that kind of thing. And the convulsing caused my IV to come out. So, I mean, they're just giving me saline at this point, so it really didn't matter that the IV came out, but they freaked out and they wanted to put it back in. Well, that's fine, but they could not wait until I quit convulsing, unfortunately. So they tried 5 times. They stuck me trying to get that IV in, and they couldn't get it in because I'm convulsing. Hello, let's wait until I get the other steroid on board and it's taken effect, and I can stop the shaking and convulsing, and then you can put your IV in with no problem. But they didn't see it that way. Okay. Hard to advocate for yourself when you're in the middle of adrenal crisis, let me tell you. So my mother did come out to help me, but at that point in time, she was having a hard time. I mean, obviously she's older than I am, so she went to a hotel room because it was very uncomfortable in the hospital room. And she wasn't there to advocate for me while all of this was going down. So finally, we got things under control. So that worked well. I went home, starting to heal. We knew the healing would be slow because of the adrenal problems and the other problems that come with not having a pituitary gland. So I think it was about 2.5, 3 weeks into it, maybe not quite that much. I started to get very red around the incision, and I felt like I was backsliding and needing more steroids to keep from going into crisis, which is not what's supposed to happen when you're normally healing. So they looked at it and they said, oh, looks like you've got an infection. I'm like, thank you, that's what I'm thinking. So the surgeon and where the surgery was done is like an hour and a half away. So this operation has many different branches across the Southern California area, different branches to help with different afflictions. It's not just hip replacements that they do many other orthopedic things. So they sent me to physical therapy, and across the hall from where I was doing physical therapy was another one of their services where they have doctors that look at patients and diagnose things and all that. So when I was doing physical therapy, I said, I think this is getting infected. So they worked me in with a doctor across the hall. so he could see it right away. And he said, yes, it is infected, and we'll give you some antibiotics. And everything worked well, and that healed fine. But the doctor that I saw, he looked at my chart and he went, wait a minute, you've got adrenal insufficiency? I said, yes. And he goes, so do I. I was stunned. My mother was stunned because adrenal insufficiency is kind of a rare thing. And there's many different ways you can get there, not just not having a pituitary gland. There are other conditions that cause it, traumatic brain injury, things like that. I don't know what caused his. I didn't ask, but he said, yes, I have it as well. So we bonded on that. One of the things that is so frustrating about this condition is that it's very hard to diagnose. I mean, it's really not. If the doctor has a brain cell working and they do the proper test, it's very cut and dry. But are they going to do the tests? Or are they just going to accuse you of being whatever? So this poor man, this doctor, he was telling me that he went in to see his doctor after saying, look, I'm having a hard time. Things are just not right. Something's wrong. And the doctor says, well, you have AIDS. How long have you been an intravenous drug user? His mother was in the room with him. He was very insulted, of course, and said, I am not an intravenous drug user. And she said, well, then how else did you get AIDS? And he said, look, you just operated on me. I didn't have AIDS before I came in here. What did you do that you gave me AIDS? Well, she walked out of the room, and the next thing he knows, he and his mother are being escorted by security out of the building. Turns out, of course, he had adrenal insufficiency. So that whole scenario that happened with him was what prompted him to decide to become a doctor, because he was tired of people like us, people with adrenal insufficiency, being treated like drug abusers or worse, whatever, whatever you think is worse. Some people might think a drug abuser is worse. Maybe it is. But I was accused of having multiple personality disorders. They told me I was very depressed and very psychotic, and I had multiple personalities. Well, I'm not a doctor. I don't have any fancy initials behind my name or any certificates on my wall to say that I am medically trained, so I didn't know better. I said, if you say so, okay, fix it, So they gave me all kinds of drugs that made things much worse, until I finally had cardiomyopathy, which is known as a broken heart attack. They call it a heart attack, even though it isn't caused by blockages or anything like that, like a normal heart attack. It's caused from not having enough cortisol and not having enough sodium, because part of adrenal insufficiency is that you don't retain your sodium. It just leaves the body. So I'm constantly fighting low sodium, putting salt in my mouth as much as I can to keep things up. So that's when they finally discovered that, yeah, what the problem is here is adrenal insufficiency. But for like 10 years or so, I thought I had multiple personalities disorder, even though that diagnosis really didn't fit me very well. I mean, with multiple personality disorder, you forget things. It's like things happen and they say you lost time. You don't remember anything that happened. That never happened to me. I remembered everything quite well. It might have seemed like I had multiple personalities because one day I'm feeling good, like I am today. And then later in the afternoon, I'm, just dead. Just let me sleep. I feel like hell. Well, that's adrenal insufficiency. But because lazy doctors want to just jump on the easiest diagnosis and not do any blood work or anything like that, they labeled me with multiple personality disorder. And I bought into it because I didn't know better. I'm no doctor. So I wrote a whole autobiography saying I have multiple personality disorder. Yeah. So this man went through being told he's an intravenous drug user and has AIDS in front of his mother. Oh my gosh. And I went through what I went through. So knowing all of this and knowing that there are other people out there that I haven't met who have gone through similar or worse accusations because doctors are lazy, I decided to write another book. So I know this is supposed to be a health update, and this is getting long and involved, and I'm sorry about that. But knowing what this poor doctor went through, the accusations that he faced, and what they had me believing, I decided that, maybe I should write another book about the adrenal insufficiency, the proper diagnosis, what I went through with the misdiagnosis, and the medicine wheel teachings, and how the medicine wheel teachings have helped me cope with all of this. So that was very inspiring. So in a roundabout way, the hip replacement surgery led to me deciding to write another book. Oh my goodness, this poor man, what he had been through. And when I think back about it, my grandmother, my father, my stepfather, my grandmother's sister, who was integral to helping me as I was being raised as I grew up, and her husband, those people are all dead now. And they all died thinking I had multiple personality disorder and not adrenal insufficiency caused by not having a pituitary gland, which leads to even more diagnoses: hypothyroidism, growth hormone deficiency, antidiuretic hormone deficiency, just all kinds of things that screw you up. So, the pituitary gland is the master gland. It does everything, really, pretty much. So it's very hard to live without. So all those people that were sacred in my mind, very important to me, that I loved dearly, each and every one of them, they all died thinking I was crazy, that I had multiple personalities. And not that there's anything wrong with having that. It's just not my proper diagnosis. And that breaks my heart, really. I'm sorry. I didn't want those people. I didn't want them to think that of me. Just like that doctor didn't want his mother to think he had AIDS or was an intravenous drug user. And I know, like I said, there's a lot of other people out there that are going through, this same abuse by doctors because they're lazy and not doing what they should be doing. So that's why I'm writing this book. But, sorry. The bottom line is, I'm fine. I'm doing much better. I was on the walker for several weeks. Then, I went to the cane, and now I'm walking unassisted. So I'm doing great. I really am. And I had my final visit with my doctor. He said everything looks great. And come next spring, I'm going to go through all of the things I have to go through to get approved to do the other hip, because it is also bone on bone. When I first went into the doctor, he said, which one do we start with? Because you need it on both. So we're going to go through this again. And I'm not nearly as afraid as I was the first time, because I know they will treat me right and things will go well. And I'm much better now, much better. And I'm very grateful that it all turned out the way it did. But this adrenal insufficiency thing, this is criminal, that people like this doctor and myself and others that I don't even know about are treated like this, accused of doing drugs or being crazy or having whatever they've decided, instead of having the doctors actually do their job and do the research and find out what the truth is. And I think the main thing is this gaslighting by the doctors. They don't listen to their patients. They assume they know. Like when I had my tacostubocardiomyopathy, say that 3 times fast, right? The doctor said, I might have to crack your chest open and teach you a lesson. You've been eating too many cheeseburgers. He didn't even ask me what my diet was. I've been a vegan for 7 years at that point. I think the amount of cheeseburgers I'd had in the last 10 years was less than half a dozen. But all of a sudden, he knows I've been eating too many cheeseburgers without even asking. So obviously, when they did the research, when they did the tests and found out it was tachystubo cardiomyopathy, oh, he didn't want to see me anymore. Did I ever get an apology? Of course not. It's just like when I had hypothermia in Indianapolis and they accused me of drinking alcohol, and that's why I had hypothermia. And 2 hours later, the blood still said no alcohol in my system. Hello, I don't drink alcohol. I don't drink alcohol. I just don't. And they wanted to blame it all on that. Finally, they did the work that they were supposed to do in the beginning and found out my thyroid wasn't working. I wish they'd have done some more work to find out why my thyroid wasn't working. Gee, maybe we could have avoided the tachystubo cardiomyopathy. Yay, I said it right that time. If they had done their work and found out it was all because I didn't have a pituitary gland. But no, that would take more than the allotted 15 minutes that the insurance company has given them for each patient. I might be sounding a little snotty. I'm sorry. I'm just very frustrated that so many people out there are being dismissed and ignored and treated badly. That's malpractice. It's malpractice when you accuse somebody of doing intravenous drugs or you accuse them of having multiple personality disorder. It's malpractice because you're not doing your job to find out what the truth is. You're not listening to the patient. So, I'm sorry, long story short, the hip replacement went well. I am so glad I did it. I'm at the point where I have more pain on the non-operated side than I do on the side that was just operated on. So I can't wait till spring, till we can get this all done again. And I got a very good nudge from the universe telling me it's time to write another book. So this one is all about the medicine wheel teachings. I'm going to try to incorporate as many of the medicine wheel teachings as I can. And about my life, it's kind of like a second autobiography, starting basically at 2000, the year 2000, because that's kind of where the last book left off, basically. I mean, it was published in 2000. But when I had stopped writing was basically 1990. When my second son was born. So I've got a lot of years to cover there. A lot of things have happened. A lot of very traumatic things in my life with my children and my ex-husband and my second husband, which became my second ex-husband. So there's a lot that went on. So that gives me a lot of opportunity to discuss how these medicine wheel teachings helped me through all of that. And of course, through the medical mess that I went through. Anyway, that's what's going on with my health. I'm doing much better now. And thank you for watching and sticking in there with me. I appreciate it.